Hey, how you doing? Just Doug from Medical. This video I'm gonna break it down Captain Morgan technique. I did a couple video already, but there's a ER drama, emergency room drama called Pit lately, and there's episode 6. If you watch about 17 minutes 20 seconds, I think on in the drama, they have a hip dislocation. Posterior hip dislocation, and then they use Captain Morgan technique. Yes, it's crazy timing, but I'm going to break it down the Captain Morgan technique on our hip dislocation data. Okay, so first you need to know how they look like when posterior hip dislocation happened. I had two cases, two students had a hip dislocation. First one, I had no idea. I didn't know what I was looking at. And then I learned later on he had a hip dislocation. And then I learned how they look like. And I'm going to show you. There's how they look like when he's dislocated. And then this how they look like on our simulator. Okay. All right. So if you see it, you have to suspect that's a hip dislocation, okay? Knees a little bit internally rotate and a little bit shorter than the other side, okay? All right, so now I'm gonna go through steps. The first, you gotta get to the side, affected side. So this side, our simulator is on left shoulder, left hip model, so you gotta get to the left side, okay? You bend your patient's knee to 90 degrees and hip also. And if you bring it 90, which means the hip will be 90 degrees anyway. And then you put your own knee underneath the patient's knee, okay? And then put your foot down on the side of the bed, okay? All right. Now, you hold your patient's ankle area, okay? And then you push down the ankle area, okay? And also, if you can lift your heels up and then slightly internal rotation, okay? So, push it down on ankle area, right? And then heels up if you can, and the internal rotation. You put all together. If you do that, there you go, plunk. Okay, so that's Captain Morgan technique, and I never done actual reduction on the hip, so I couldn't tell if it's really good or not. So I went to Smasa Sports Medicine Associates of San Antonio Saturday morning, and then I talked to Dr. Curtis and Dr. Lopez, Dr. Science, and they try it, and it's hard. And Curtis, he tried, his face was red, and
Dr.
he likes
Science
it. So it's approved. So now going send it back to Sawbones, and it's going to be actual real production happening. So I cannot tell you exact time frame, but it's coming. So if you are interested in, please contact sales@techlinetrauma.com, and they are my official distributor, and then give you the pricing. Okay. I also created shoulder and elbow and the finger dislocation data already. It's already in the market. You can purchase through Techline also. So sales@techlinetrauma.com. So please reach out, and then they're gonna help you out. So that's it for today for Captain Morgan technique. Thank you.